Good morning, everyone. Before I have Dr. Morrison and Chief Nurse Dowling provide their regular weekly update, I wanted to just join today because this week marks an important milestone in this journey we have found ourselves on together. 6 months ago today, or yesterday, we had our first case of COVID-19 in Prince Edward Island. 6 months ago tomorrow, we declared the beginning of our public health emergency, which still exists today. And 6 months ago today, we didn't know what we had in front of us. But I think we all recognized very early on in this pandemic that by trusting the science and the advice of health professionals under the leadership of Dr. Morrison and Chief Nurse Dowling and their incredible dedicated team of professionals, that we could and would get through this together. And to date, I'm happy that we have done that. I am extremely proud of our provincial response to this pandemic. Though we have been riddled with uncertainty and unknown, we have persevered. It has not been easy, to state the very obvious. It has not been without challenge. But we have managed it, I believe, as well or better than most other jurisdictions, and I'm deeply, deeply proud of that, and so very grateful to all of us as Prince Edward Islanders who have rallied, who have come together, who have listened, and who have shown great resilience, and most importantly have shown that great sense of community that makes our province the best place to live, work, and raise a family. Everyone in this province in some way, shape, or form has been impacted by this pandemic. Islanders of all ages and walks of life, seniors, grandparents, parents, and children, whether you're an entrepreneur, a business owner, a teacher, a student, a doctor, or a nurse, the way we live our lives today is drastically different than it was 6 months ago. But we have changed and adapted to this term we now call the new normal, and we continue to live our lives in a careful and safe manner. We have endured a difficult 6 months. There is no doubt there is fatigue with COVID-19. I know I feel it. I know Dr. Morrison and Chief Nurse Dowling feel it. And I know all Islanders feel it. And I wish I could tell you today that we are through this, and I can't wait for the day that we can appear here and say that we are through this. But as of today, we aren't. And every day we continue to learn more and more about this virus. Our experts watch and listen to what is happening around the world and across our country, and take that information to develop the best practices, new protocols, and innovative ways of ensuring the safety and well-being of Islanders. And as much as we think our lives have changed in these past 6 months, and they have, and that will continue, how we live our life today will be likely different in the next 3, 6, and 9 months ahead. That seems to be the one consistent trend throughout this pandemic, is that we are in constant change. We are seeking new ways of living our lives instead of going back to the old way, which is probably a good thing. We are adapting our daily lives to ensure that our families and friends and communities are safe. And we are taking cautious steps when it comes to our most vulnerable populations. I've said it before, COVID-19 knows no boundaries. It doesn't matter your gender, or your skin color, your occupation, or your age. We are all susceptible to contacting this virus and spreading it to others. So we have to be and continue to be very, very careful. As a government, we will continue to be ready to respond to the needs of Islanders. We will be here in the good times and the bad times, and that is the job every day. We have a variety of supports available as a government, and I want every Islander to be able to access the help if they need it. If that means changing the way we have to deliver government services, then so be it. We have done that in the past, and we will continue to do that because we recognize that above all else, we need to be responsive to your needs in the days, months ahead. I want to take a minute to thank our seniors and families that are residents in long-term and community care. I know keeping our seniors safe has been very tough, and it has taken a toll on so many of us. Your patience and understanding continues to be appreciated. Thank you also for participating as Islanders in the wonderful staycations here in Prince Edward Island. We have rediscovered parts of our province, and in the process, we have supported local businesses, and that has made a significant difference across this province. I also want to make some special mention today to the teachers, students, administrators, bus drivers, educational assistants, counselors, our student well-being teams, and other support staff within our education system. They have shown in these past 7 days that we are resilient. In the most complex situations, we have demonstrated that we can work together to adapt our daily lives to ensure everyone's safety. And I hope and pray that continues in the days ahead. As I have said at the beginning, we have been through a lot. And there is no doubt a long road ahead of us with this pandemic. There will be many more unknowns, but we need and will continue to be vigilant, to be patient, and to be measured within our response. We are listening and learning every day, and we have made the best decisions using the best science, the most up-to-date public health information, the best research and data, and that will continue as we move into the fall and then into the winter, facing what most health experts believe and expect to be a second wave of COVID-19. To the best extent we can in these most difficult and unknown times, we are prepared for what will come next. And we will continue to be nimble and to adjust our measures when that approach is required. There has been and there will be more bumps in this road. There will be ups and downs, but we will get through this together as one team across the province. 6 months ago, we began this journey together with the ultimate goal of keeping Islanders safe and healthy. That goal remains. And for us to ensure that goal is met, we need to continue to be united and to heed the best public health information, advice, and protocols, and to remember, above all else, who we are as Prince Edward Islanders. I'm very, very proud to be the Premier of this province, and I thank everyone for their past efforts and look forward to that continuing in the future. So with that, Dr. Morrison, I will turn it over to you.
Thank you, Premier. As you mentioned, yesterday marked 6 months since our first case of COVID-19. And at that time, many thought and hoped the pandemic would be more short-lived and life could get back to normal within a few months. And Islanders have all done what has needed to be done to put P.E.I. in this position with really such good results in terms of limiting the spread of COVID-19. We now know that COVID-19 is here for the long term, and really until such time as there's an effective and accessible vaccine or treatment. And while vaccine research and development is progressing, the best case scenario for a COVID-19 vaccine is certainly in 2021. In terms of our cases and numbers, today I can confirm there are 2 additional cases of COVID-19 in Prince Edward Island. One case is a male essential worker in his 50s who had recent international travel who tested positive on routine testing. This asymptomatic individual does not work in healthcare and has been self-isolating since arriving in Prince Edward Island. Contact tracing is underway. The other case is a child less than 10 years of age who is a member of the family who had positive results last week. This child had a questionable result last week and the swab was sent to the National Microbiology Lab in Winnipeg for additional analysis. The sample was confirmed positive yesterday. And although not a confirmed case last week, this child was treated as a case and self-isolated with their family. And this child is now considered recovered. So at this point, we actually have 1 active case of COVID-19 in the province, and 56 cases are considered recovered. Since the pandemic began, we've had the total of 57 cases of COVID-19, all related to travel. There have been no hospitalizations or deaths in P.E.I. related to the pandemic. And in reflecting on what we know now, when we go back to early March, when our first case was announced, we know that COVID-19 has a devastating impact on elderly in care facilities and others who are immune compromised. We know that children over the age of 10 seem to transmit the virus similar to adults. We know the virus is spread through close, sustained contact, estimated up to 15 minutes. We know that asymptomatic spread is not uncommon. We know that public health measures such as physical distancing, washing your hands often, staying home when you're sick, limiting the size of gatherings, and wearing a mask in closed indoor spaces are effective measures in limiting the spread of COVID-19. We know these measures have flattened the pandemic curve in P.E.I. and in other jurisdictions. We know the immunity level to COVID-19 within the population is very low, likely less than 1%, and that we are at risk of importation of the virus. We know that COVID-19 has affected all aspects, as the Premier mentioned, of our lives, from jobs to the economy to our social interactions and our mental health. We also know the majority of Islanders continue to be very cooperative, following advice and adapting to our new normal, and most Islanders know we cannot be complacent. But just as COVID-19 has taught us a great deal in the last 6 months, we will learn more in the months ahead. A total of 30,400 COVID-19 tests have been completed in P.E.I., including 1,836 in the last week. There was a 22% increase in tests compared to the previous week. In terms of COVID testing per capita, P.E.I. still ranks second in Canada, having conducted 200 tests per 1,000 population compared to an average 165 cases per 1,000 in Canada. And although all 57 cases of COVID-19 in P.E.I. have been related to travel, we do not have widespread community transmission, and this supports the effectiveness of self-isolation in containing the spread of this virus. And the experience in our province and in other jurisdictions highlights that self-isolation is effective in containing the spread of this virus and, in effect, interrupting the chain of transmission. And we are fortunate that recent cases have all been self-isolating and respected that requirement, and they've had very few contacts, which has made contact tracing very manageable and limiting the transmission of COVID-19. Unfortunately, and I think this is part of the COVID fatigue, many people no longer see the value or need to self-isolate and instead want to skip self-isolation or do it for less time. But people who choose not to self-isolate are putting themselves, their families, and our community at risk. And I ask all Islanders who are required to self-isolate to take it seriously and limit their contact with others. We are actively exploring options to address issues related to rotational workers who regularly and routinely travel out of province to work. These workers are home for short periods of time, and some are in self-isolation for most of that time, meaning they spend very little time with their families. And I'd like to thank all our rotational workers for their patience and understanding as we work to find a way to balance an acceptable risk of COVID-19 transmission with the need for them to spend more time with families and for the limited time they are home. And of course, there are also workers traveling to P.E.I. from other provinces to do work that is important for Islanders. And these workers support our island economy in many sectors, such as construction, manufacturing, processing, bioscience, and aerospace, to name a few. The feeling of being COVID weary is normal. And again, as the Premier mentioned, each and every one of us can relate to that feeling on some level. And while we've been and become adept at knowing that public health practices that are effective against COVID-19, we've had to guard against fatigue that can lead us to relax our personal precautions. Now more than ever, as we shift activities indoors, we need to be cautious and not let our guard down. We have to continue to adhere to public health measures when at work, at home, at school, and in the community. And this also may mean that we should note that islanders and visitors are required to stop and answer questions at our points of entry. Some outbreaks in other provinces have been traced to smaller, more personal gatherings. And this is a reminder that the risk of transmission is not lower just because we know people at an event. There have been recent Canadian examples where just one infected person with mild symptoms at a small gathering started a sort of a chain reaction of COVID infections. Likewise, there have been clusters in educational settings in other jurisdictions. Transmission in these settings is a reflection of the infection rate in the community. It serves as another reminder of the importance of keeping community transmission low. So, island teachers, children, and staff have been in school now for a full week, and there have been great positive comments about how well everyone is adjusting to the new procedures. But we know there will be challenges along the way as the education system deals with the unprecedented challenges of COVID-19. And I've said this before, and I know others have said it as well. Successful return to school is very important, certainly as a parent and as resident P.E.I, and the education of our children is an investment in them and the future of our province. And a successful school year of in-class learning is contingent on low community transmission of COVID-19. So the decisions we all make over the next few weeks will affect our children. So we need to stick to the basic public health measures to keep our schools safe. And over the last couple of weeks, I've shared my hope for what can be a new normal as we progress in early October. And I balance that with the caution as we see increasing number of cases in certain provinces in the country. And by the end of the week, I expect there will be a number of updated documents posted on the website, including updated guidance on detailing the new normal for P.E.I proposed for early October, updated guidance on multiple gatherings, updated sports and recreational guidance, updated school outbreak guidance, as well as the CPHO school directive to add to the directive for early childhood. We can talk about reopening because we know more about COVID-19 and because we've done so well as a province with a very low incidence of COVID-19. And so while we look forward to the new normal with hope and anticipation, we are aware, as I mentioned, that in other provinces there's been a more rapid increase in cases and hospitalizations, which is concerning. The past 6 months have been challenging and at times overwhelming for all Islanders, including the team in our office. And like all Islanders, there are days when we wondered how we were going to get through this, and then we found the strength to persevere and keep going together. An amazing team of professionals, dedicated people across the board. And Islanders have been so resilient, and we will get through this, and we will get through this together. I have been touched by the many acts of kindness shown to me and my family and the team, including some very thoughtful gestures, both from friends but also from complete strangers. And thank you to each and every person who has made an effort to support my family, our team, and other healthcare and essential workers and Islanders. And every gesture has been greatly appreciated. And thank you all. So as I always end, please be caring and compassionate. Please continue to be patient and continue to be kind. Thank you. And I'll turn it over to Marion.
Thank you. Good morning, everyone. I want to provide a quick update on some of the equipment that has been going along with our preparations and planning for the response to COVID-19. And let Islanders know we have received 5 of the 12 ventilators that were ordered and expected to arrive this fall. The additional 7 will arrive in the coming weeks. And these new ventilators will require some setup and training, which is currently planned and happening. And that will bring our on-island number of ventilators. Just to remind people, we have currently 19 in use, which is 4 to 5 times what we would normally use in our services in normal times, and we had received 10 from the National Emergency Stockpile and this additional 5, so our total now would be 34. As always, we continue to carefully monitor the personal protective equipment supplies and our level of those, and purchase more in order to be prepared in any surge in COVID response. Testing continues to be a priority for our response team as well, as it does for Islanders. With schools open and as cold and flu season approaches at the same time as a possible second wave of COVID-19, we know having access to tests quickly is important for keeping everyone safe and ensuring our province runs smoothly. The new no-appointment drop-in testing clinics are currently running in O'Leary, Summerside, Borden, Charlottetown, and Montague. Clinic times are available on the COVID-19 section of the provincial government site. Scheduled clinics are still available and offered in Charlottetown at the Eastlink Centre and in Summerside at Slemon Park. To access scheduled testing, people must call their family doctor or nurse practitioner or call 811 for a referral. And if a test is required, they'll be given a scheduled time and instructions. As a reminder, the swabs retrieved at our testing clinics are processed at Health P.E.I. laboratories, and results are generally provided within 24 to 72 hours. Negative test results are available through the Negative Test online website, which also launched last week. People with a Health PEI card can begin to look on that website as soon as up to 24 hours after their swab was taken, and results may only be posted up to 72 hours. This week, we've also begun offering testing for people who require a negative COVID-19 test result for travel to another country. The process to access this testing is different from other testing. International travelers requiring testing can either call the 1-833-533-9333 line or email covidtravel@gov.pe.ca. This should be done at least 5 days before departure to receive a scheduled appointment. They will be provided an appointment time, and once they have their appointment, these travelers need to contact the Queen Elizabeth Hospital Health Records Department by phone, and their number is 902-894-0257, or email, which is quehroi@ihis.org. Explain in your message that you need the test results before your international flight, and the Health Records Department will obtain your consent for release of those test results information. On the day of your test, you email that Queen Elizabeth Hospital Health Records Department, and in the subject line indicate urgent flight, and in the body of email provide your name, contact information, and the date of your flight and the day of your scheduled test. The Health Records Department will send you the results by email as soon as they are available, and information on this process will be posted to the testing section of the provincial government COVID-19 website today. As a review, testing numbers continue to increase, as Dr. Morrison mentioned. Yesterday, a total of 355 tests or swabs were taken at our various clinics, making for a very busy day. In particular, in Charlottetown, our drop-in clinic saw 125 people swabbed, and 96 visited the Charlottetown scheduled clinic. There were 46 at the Summerside scheduled clinic, and 35 people visited the Borden drop-in site, 28 at the Montague drop-in site, and 25 in the O'Leary drop-in site. I want to thank the staff and physicians who work at these sites and the provincial laboratory staff in processing these tests so quickly. A reminder, as always, to seek care with our system if you need it, and please bring and wear a mask to protect everyone. Thank you.
Well, thank you both very much, and I think we will now turn it over to some questions from our friends in the media.
Allison Jenkins, The Guardian.
Yes, good afternoon. I'm just wondering, will trick-or-treating be allowed, or will there be public health restrictions on Halloween?
Hi, Allison. So we actually have been looking at what my counterparts are doing across the country with regards to Halloween. I think we have been thinking about it, talking about it as a team. And Halloween may look a little different. We realize it is enjoyed by many, but I think it's still 6 weeks away, so we are talking about it, and we'll have more to say about Halloween in the coming weeks, but it may look a little bit different. We may need to think about how we do things a bit differently, like we are for many other aspects of our lives, but I think we'll definitely talk more about Halloween in the coming weeks.
Okay, thank you. And just wondering if there's any extra monitoring or surveillance surrounding the return of the students to universities and colleges and that kind of thing, and just around large gatherings.
So, Alison, I think you probably realize that the international students that are coming to post-secondary institutions in this province the international students are being self-isolating in a designated facility in Charlottetown, and students that are coming in from outside the Atlantic bubble to post-secondary are isolating with an approved self-isolation plan, either in residence or in their own dwelling. And testing is also part of that process in terms of both international and domestic out-of-bubble students. So certainly that has been involved great deal of work by the post-secondary institutions and testing and isolation facilities, security, etc. And that has been the big focus for us at this point over the last couple of weeks, and that continues. We still have a number who are in our designated facility, for instance, that need to complete their self-isolation. We've had at least 110, I believe, who've completed their period of self-isolation out of the designated facility, plus those who have completed self-isolation in their residences as well. And I think we've talked about it a little bit already, that the concern around the potential of asymptomatic or very mild symptoms spreading when you're having gatherings and being in close contact, and that there are certainly there's evidence of that happening in other parts of the country. So that will continue to be important here, and part of the public health measures both today and in the weeks ahead.
Great. Thank you very much.
Carrie Campbell, CBC.
Good afternoon, everyone. Thanks for this. I just wonder, first of all, with the prospect of a by-election coming, if Dr. Morrison and anyone else who wants to jump in, the Premier or anyone, Marion Dowling, I'd love to hear it. But I just wonder, Dr. Morrison, you first of all, if you've given any thought to what sort of conditions or limits or anything else, guidelines you might want to put on campaigning in a by-election.
So, hi, Carrie. So we've been certainly in touch with the elections office here in Prince Edward Island, and the recommendation not to do door-to-door in-person canvassing or meeting as part of the lead up to the election, and so I think that has been communicated, and we have been in correspondence with them. So I think that would be my first comment, and I don't know if Premier, you want to add anything to that.
I would only add that if the by-election were to be held within the next little while, I wouldn't be suggesting that the candidate from our party would knock on doors. I don't think people would be open to seeing that. So look, we've asked Elections P.E.I. and the Chief Public Health Office to weigh in so we can have a safe election where people feel comfortable to get out and vote in some way, shape, or form. I think we just saw a result in New Brunswick yesterday where the voter turnout was about the same as it was in 2018. So the level of confidence individuals had to vote in that province was seemingly high, and I would like to think that we could deliver something here. But everything else we have done to date has been trying to put the health and safety of Islanders first, and that will be the priority for a by-election in District 10 when that is held.
All right, and a separate topic, Dr. Morrison, and maybe Premier King, if you want to chime in as well. Dr. Morrison, you made it clear about the fact that all of our COVID cases have come as a result, they're all travel related. I just wonder if you have provided any directives to the province in terms of immigration programs, kind of what the parameters maybe should be for those to kind of kick back in again. I mean, I think we've had a little bit of immigration coming throughout the pandemic, but just what kind of criteria have you given them? Are those being followed? And just how do you feel about, operating those programs on some kind of basis, while we do face this risk of transmission of the disease across international borders?
Well, Carrie, I mean, some of the decisions around programs are almost made at a federal level, and the Premier may be able to add to that. So those decisions aren't really for our office or the province, and it's really, from my perspective, trying to figure out, once those decisions are made, how we can do it safely. And I mean, an example is our international students, our temporary foreign workers, refugees would be sort of categories that are really have a federal involvement in those decisions. And certainly our team, and with many others supporting that, trying to make sure we really appreciate the risk internationally. We know the United States, India, Brazil are the top 3 countries in terms of numbers of cases, but there's cases worldwide. We have more than 29.5 million cases in the world. So there's that risk of importation internationally, which we're aware of, but how do we make sure that people self-isolate when they get here with the supports they need? So I might just, I'll start there, and maybe you want to add.
Yeah, I don't have much more to add other than that many of these federally regulated streams, when it comes to immigration, have continued, and I think as a country and as a province, we want to see continue. The conversation that we've had over the past number of months has been anybody essentially coming from outside of Prince Edward Island for the first while, prior to July when we expanded to an Atlantic bubble. We have asked and put in place a 14-day self-isolation requirement, and that continues. So, for example, with streams such as our temporary foreign worker program, for example, we put in place a 14-day isolation. We've dedicated facilities to do that. We know who is coming in, where they're coming from, when they're arriving, and where they are going after they arrive and successfully complete their self-isolation. So as we ease back and learn to live with COVID, and those streams begin to open up a little bit more broadly in the future, the big question would be just around making sure that we have that self-isolation in place. And as Dr. Morrison has said, that incubation period of 14 days seems to be the magic number, and I don't anticipate that changing in any way for those arriving from certainly outside of the the Canadian borders in the near future. But look, as a province, we need immigration. We depend on growing our population through many streams, including immigration. And even though we're in a worldwide health pandemic, that has to remain a focus for the long term, and it will.
Thank you.
Louise Martin, CBC.
Hi, and good afternoon to all three of you. So my first question is surrounding the COVID fatigue. I believe both the Premier and Dr. Morrison mentioned that is happening, and they can see that it's happening. So maybe I'll start with you, Dr. Morrison, and again, I'll pull a Carrie Campbell if the Premier wants to weigh in, please do. But as far as COVID fatigue is concerned, and some people, you said, Dr. Morrison, choosing not to self-isolate. So does that mean there's been an increase in charges, complaints, violations on PEI?
Louise, yes. Certainly the people who are doing our Operation Isolation calls are hearing people more unhappy about self-isolating, and there have been more complaints about people not self-isolating. And I don't believe I have the enforcement numbers here with me, but we can certainly provide those, or I can bring them next week. But there have been certainly more complaints that we are following up on, and I think partly that's natural. I think the other part that we're really trying to make sure that we are clear on is the whole stream I mentioned of the rotational workers, and how do you balance that need for people to be out of the province, and especially if they're coming back and forth on a regular basis. So it's so I think there has been an increase in the complaints, but we're hoping that partly talking about why we're doing it and how important it is to protect your own family and our community. And if we don't do as a collective a really good job, then we will have community transmission, which will then have different impacts. We look at British Columbia, and they've said now they don't want anyone to gather in more than groups of 6. Quebec, who has really again, sort of enhanced public health measures, more restrictions lately. Ontario, which has decided they're not going to ease up on measures over the next 4 weeks. And they've had to do that because there's been more transmission in the community. So if we want to look after our families and our province, then we all need to take responsibility for that.
Yeah, and I think people are, Louise, just to expand upon that, I mean, I think obviously when we talk about the past 6 months, I mean, for many of us, it feels much, much longer than that. It feels like it's been a grind, and it has been. That takes its toll on all of us. And yes, I think we're hearing more people are more vocal about their complaints, but I do believe it's still important as Islanders to remember how we've gotten here and how we are going to get through this. And it is difficult, and all of our lives have been impacted and have changed. But that said, we have taken the responsibility to look out for one another, I think, to a far greater level than any other jurisdiction, certainly in this country and on the continent. So I expect that will continue, and I will continue to ask Islanders to, even though it is difficult, even though it is hard, even though we are tired, we have to keep going forward with what we have been doing, and the only way to get through this is to keep going.
Thank you very much to you both for your responses on that. I guess my next question will be for Ms. Dowling, and it's about the international, the testing for if you're traveling internationally. So I'm just wondering about what the criteria will be. So do you have to make an appointment and list your reasons for traveling? So what is the criteria? What criteria do you have to meet to be tested? And how reliable is that kind of testing for someone who may have no symptoms of COVID and potentially at low risk from a province without community spread?
Hi, Louise. I'll give you some information, and Dr. Morrison may want to add about the reliability, but what we were trying to provide for people is that now that other countries are opening their borders to travel, we needed to be, they're requiring negative COVID tests in order to, I think some may have been airlines, some may have been the country of entry requiring a test within a certain number of hours of the travel, the date of travel. So that's why we're trying to create a streamlined process for those individuals who do need to travel to other countries to be able to access their results and provide proof of their negative COVID-19 test result within that short window of time. I think it may be 72 hours of the test and the date of travel that it needs to happen. So we have to be able to turn those things around quite quickly for people, which adds to the reliability of the test at that moment in time for the person traveling. So that's really the purpose of us putting that in place, is that we know those limitations have been placed upon individuals who do need to travel internationally, that from those other countries or from their mode of transportation. Don't know, Dr. Morrison, if you want to add anything more to that?
I think it's just a negative test, especially with asymptomatic in asymptomatic people. We've talked about it here before. It has limited sensitivity and specificity when it's just the one test at that time with asymptomatic people, but it is a requirement that other countries are putting in place, and I mean, so I think it's helping. We're really helping facilitate that travel for people who may have to see family or work in another country, and it's really just part of that process.
All right, sincerely appreciate your responses. Thank you so much.
Sarah Plowman, CTV.
Hi, thanks for taking my question. First for Premier King, and then perhaps if Dr. Morrison could weigh in. There's an idea being floated here in Nova Scotia today about having a streamlined approach for sort of expedited testing for students, a way to manage outbreaks in schools. The idea would include sort of on-site testing at schools, mobile testing, dedicated communications line for school administrators, just kind of prioritizing results for students and staff at a time when some people are spending a lot of time waiting on 811 and to get their test results. Is this something that is being considered or has been considered in Prince Edward Island? And if so, what would that look like?
Hi, maybe I'll just jump in here, and I think we've been talking with education and the school systems around certainly the communications and already having some plans for how the communication would roll out for students if there was an outbreak in the school. We've also had conversations around the ability, accessibility to manage even a mobile testing site at a school, for instance. We've had some experience already in other outbreaks where our partners with EMS have assisted the testing clinic in being able to set up a mobile site if it was required. We've also now with our drop-in clinic ability, people are not using 811 here in Prince Edward Island. They may still be using 811 in Nova Scotia, and so that also will make it a little bit easier. So and also we've talked about the fact that in any kind of outbreak situation, those who need to be tested will be identified through public health as needing testing, and it will and how important that messaging and that communication will be. So long answer to say yes. I think the communication has been discussed, and we'll have an ongoing discussion with them. I know we mentioned putting up outbreak guidance that it will complement what's already on the web from education, as well as knowing that we have capacity, and even so much so that we have a pre-positioned group of swabs, so that would be ready to be sent directly to a particular school or region of the province that we needed to deal with an outbreak of schools. So that it would be sort of a pick up and go delivery for those additional swabs, et cetera. So that discussion will continue, and I know it's something we're all learning from each other in terms of the provinces as well, as we see what's happening in schools in different places.
Laurent Rigaud, La Voix acadienne.
Good afternoon to everyone. Dr Morrison, j'ai une question pour vous en français. Vous avez beaucoup parlé de l'auto-isolement, de l'importance de l'auto-isolement pour éviter la transmission communautaire. Et on voit qu'il y a des discussions au Canada ou ailleurs, dans d'autres pays, pour réduire la durée, pour passer de 14 jours à 10 jours ou à une semaine, par exemple, pour que ce soit plus facile. Et parce que le virus, on le connaît mieux aujourd'hui. Est-ce que ce sont des discussions que vous avez avec vos collègues au Canada pour réduire la durée d'isolement?
Oui, bien sûr, on discute avec mes collègues partout au pays, et on regarde ailleurs, hors du pays, pour l'évidence et le support de réduire la période auto-isolée. Et puis, alors on suit la science et l'évidence pour ça. Et puis, et on demande les questions, si on réduit, on fait les tests, ça peut diminuer la risque. Alors, on est en train d'en discuter. On a des comités qui regardent l'évidence avec notre bureau et celle des autres provinces. Alors, j'espère que à un moment donné, on peut réduire, mais à ce moment, c'est 14 jours, vraiment la plupart du monde.
Merci. Et j'avais une autre question sur les symptômes, les cas qui ont été annoncés ces dernières semaines. Vous avez souvent dit qu'ils ont été testés. C'est le test de routine 10 jours après leur arrivée qui a permis de voir qu'ils étaient positifs. Est-ce que on voit est-ce qu'il y a une différence par rapport au printemps? Est-ce qu'il y a moins de gens avec de la fièvre, avec de la toux, avec du mal de gorge? Est-ce que le virus il change?
On n'a pas, partout au pays, il n'y a pas beaucoup de changements des symptômes. Il y a une variété de symptômes qui sont pas beaucoup, ou tellement, ils sont pas tellement beaucoup de symptômes, mais même depuis le début, moins de 50% des cas ont la fièvre. Comme exemple. Les tests qu'on fait avec les personnes qui voyagent international sont comme une autre mesure de sécurité vraiment qu'on fait même s'ils n'ont pas des symptômes. On fait ça avec tous les gens qui arrivent hors du pays.
Merci.
And I believe that brings the end to our event. So thank you both for being here, and thanks to our friends in the media. So have a great day.